Temptation here with a sick video coming your way today. It is truly the toughest, hardest, worst admission of my life. And guys, if you know me, you know I've been admitted to the hospital so many times. This is not a new thing for me. I just got out of the hospital actually. You see my PICC line, have my antibiotic running right now. But this admission kicked my booty. So I go into this admission with hemoptysis. That's coughing up blood, comes from an infection, a vessel gets broken from irritation and coughing and inflammation. So I go in to get this hemoptysis addressed. So I'm coughing up blood before the admission and then into the admission. So typically once you treat the infection with antibiotics, then the bleeding will stop, the irritation will stop, and then all is well and you can move on with your life. However, we're treating me with antibiotics. It's not working, so I'm still coughing up blood every day, 2 to 3 times a day. And at this point, they decide that they need another solution. They need to address the issue with something else. And so they approach me and they tell me about this procedure called pulmonary artery embolization. And if you have cystic fibrosis, you've probably heard of this. You probably have also been talked to, and this is something that's the last resort. There are a lot of risks to this procedure and a lot of things that could go wrong. And so they come to me to tell me the risks and to get my consent to do the procedure. And the biggest risk that they tell me is there are multiple arteries that feed your lungs blood. And so they could embolize, meaning clot off, block off, cut off the supply. They could embolize the wrong artery. And the problem with that is not that they just missed and they'll cut off blood flow to a different portion of the lung, but the artery that's next to or in proximity to the artery they need to clot off is near an artery that feeds blood flow to the spine. So they say if we cut off blood flow to this particular artery, the incorrect artery, then your spine won't get blood flow. That's a problem because you will be paralyzed. So that's a big one. So Marlene and I talk it over and we decided to go through with it because it doesn't seem like there's any end to this hemoptysis. So at this point I had coughed up blood about 12 times. I'll probably throw up a picture on the screen of what it looks like in a little measurable cup, and you all can kind of see how much blood. This was one episode of blood that I coughed up, and at this point it may have been like the 8th or 9th episode, but I coughed up blood more into that day and then even the next day prior, like right before the procedure started. And so we go ahead and do the procedure, and you know, when they're telling you about these risks, you're thinking like, okay, these are the things that just don't happen to people. Like these are the liability things. Like we have to tell you these things that they could happen. Like there's a chance of death. Like there's a chance of cancer. Whatever. Like they tell you all these things, and you're like, yeah, just do the procedure. Like let's take care of my issue. So I signed this consent. We're doing the procedure. They tell me that this procedure required extra sedation or additional sedation. They had to keep me under longer, and they had to give me more contrast dye through my PICC line. I also had a PICC line at that time as well. And they had to do that in order to get a visual to embolize the correct artery. So they're having trouble finding the artery. All in all, the procedure finishes up. They embolize the correct artery. I'm not paralyzed, thank goodness, and all is well. My recovery, so that the hours after the procedure, my recovery is not going well. All the extra sedation and all the extra contrast dye, I don't know, I keep putting in my stomach, all the extra contrast dye that they put in my PICC line is causing me to be sluggish, and the extra sedation is causing me to be weak, really nauseous. I didn't want to eat. So now we're at the 24-hour mark from the procedure. This is where the video gets crazy. So if you didn't watch any of the first stuff, if you weren't paying attention, if you were petting the cat, stop petting the cat, pay attention, because this is juicy. Marlene's sleeping in my hospital room and I'm living life. I have to go number 2 I don't want to wake her up to get help. I was having trouble walking at this point, but I'm like, I'm a man, I can do this poop by myself. And so I stumble into the bathroom, you know, I'm weak and I'm groggy, and I sit on the toilet, and remember, they go through my femoral artery to do the procedure. This was the day prior. They do the procedure. I have this wound on my groin. They access the artery through my right leg, and so there's a hole. They glue the hole shut after the procedure. Not stitches, not whatever, not cauterization. They glue it. And so I'm on the toilet, and I'm doing the business. And now the issue is that I'm constipated. Pain meds do that to you for the procedure. The sedation does that to you, so things aren't moving. So I give a little bit of effort, not a lot. Honestly, not much pushing to get this bowel movement to proceed. So I'm pushing a little, and I mean a little, and I feel this pop. It's like, well, that was a strange pop. You know, I'm already in pain from the procedure itself. And so I go on with my poop. I move on, and I'm looking down, and I start seeing this like kind of like bulging on my leg, my upper leg. The bulging starts to grow to my groin area, and it's like swelling, and I'm like, this is odd. This can't be a good thing. Then it gets big, and I know there's an issue. In my head, so it's like in the moment you don't really know what's going on. You just know there's an issue, and so I'm an intelligent young man, and so I can tell that there is bleeding. There's a hematoma that's growing in my leg and groin, and I'm aware that I just had a procedure the day before that worked on the femoral artery. This is a big artery. This is the biggest artery in your legs and in your lower body. I put two and two together, and I realized it's probably my femoral artery that's causing this bleeding. And what the heck am I supposed to do? It's internal bleeding. So this is not something you could just look at and cover up the spot that's bleeding and gushing out blood. This is inside my body. So I'm losing blood. I realize I need help. And I start yelling out. The bathroom door is open because I am a savage and I didn't close the door while I go number two. So Marlene's sleeping in my hospital bed, and I'm yelling out to her, whew, this woman is a heavy sleeper. So she's not waking up. I'm panicking. I'm yelling out, and I'm banging on the door, and she is sleeping like a baby. So I'm yelling so loud, and the hospital door is shut. I mean, the room to my hospital, the door is shut. And so, but I'm yelling loud enough that my nurse, hears me from down the hall at the nurse's station. And she runs in, and at this point, I'm getting weak. I'm getting really sweaty. I'm really scared. I'm panicked. And I'm actually holding my own pressure. I'm holding pressure on this area because, I don't know, I just figured that's probably the appropriate thing to do. And so she's like panicking. This is night shift, by the way. This is kind of the transition shift change time of day. She calls what's known as a ACT at this particular hospital. And ACT, for others of you in the healthcare industry, this would be like a rapid response, or at Freeman Hospital in Joplin, I believe they call that a first team. Anyway, something like this. It means everybody get your butt in here. There's a situation. It's not a code blue. No one's dying, but we need to address the situation rapidly. And so everybody starts pouring into the room. And we get about 6 people deep, maybe 7. And Marlene wakes up, and she's like panicked because she realizes something happened. She comes in. I'm on the floor. I've become so weak, and they've kind of assisted my fall down to the floor of the bathroom. I'm laying on this cold, hard bathroom floor, no shirt. My pants are down. I'm exposed because I was doing the business. And so she starts panicking. I'm panicked. This is night shift, folks, now. So we have some ICU nurses. We have some charge nurses. We have the rest of the nurses from this floor. And they're all deciding what to do. And quite frankly, they don't really know, because this is not a situation where there's an open wound somewhere and they know immediately to put pressure. They're not updated. They're not all updated on my case, my particular situation. And so they don't know that the day before I had this interventional radiology procedure done where they cut a hole in my groin, and they don't really know exactly what's going on. I'm like too panicked and also weak and like kind of faint-ish to be able to verbally like communicate to them that I think my artery's ruptured. And so, and Marlene's kind of telling them, but they're in like this work mode where they like only listen to like kind of each other, because they're like, you know, they're the medical professionals. It's not really my job to tell them like, hey, here's what happened, here's what I had the day before. It's more like their job to address a situation that they see as being medically relevant to their profession. And so not really listening to us or to what we're saying, and also, you know, we're not probably communicating it in the best way given the situation. Finally, they realize like they also need to put pressure, and they're kind of screaming back and forth, and we finally convey the message that like I had this interventional radiology procedure, and so somebody's like, call pulmonary intervention, call pulmonary radiology. That's not a department. And so they're like, some nurse is trying to look up the number of like pulmonary intervention, and like that's not a thing. So they can't get a hold of anybody because they don't have a number to call. And we're like, no, it's interventional radiology. Call them. So they call interventional radiology to see for some advice. They're like, we got this guy on the floor. His artery appears to have ruptured. He's bleeding out. They took my blood pressure. It's 90/50. And if you're in healthcare, you know that like that's panic time. Like we got a problem. If it had started normal and ended up at 90/50, and the situation is not being addressed with the right steps, this could be life-threatening. And so, interventional radiology tells them to hold pressure. Everybody as a unit kind of makes the choice to go ahead and put me in the ICU. So we get me stable. Somebody's on my groin, holding pressure, and man, it's a sensitive area for one. For two, I just had a surgical procedure cut into my leg the day before, so it's already in pain, and now we're putting enough pressure to hold the artery from leaking out into my groin, my leg, and man, this hurts like crazy. So they wheel me down the hall, into the elevator, and upstairs to the ICU. So now I'm in the ICU. This is what they have to do. So they have to do rotations. You can't just put pressure on an artery and then leave it that way, because your leg still needs blood flow. Your muscles still need oxygenation. I probably slaughtered that. And so they have to do a rotation. Every 20 minutes, someone's holding pressure for 20 minutes. And then, so it's like 20 minutes on, 20 minutes off. They're switching out. Sometimes the doctor's coming in, they're doing a rotation, holding pressure. Sometimes it's my nurse, sometimes it's the other nurse. And they're rotating because it's actually a lot of work to put the amount of pressure needed to clot off an artery or to hold pressure onto an artery. It actually takes a lot of work. And so they're switching out. Every time they're holding, I'm like screaming out in pain. And they also have to go easy on pain medicine because my blood pressure had tanked and I lost a ton of blood into my groin. So they got to go easy on the pain medicine too. So it's kind of like a lose-lose situation. At this point, I'm in the ICU. They've done some imaging. They've determined that I'm kind of stable-ish. But they know I'm going to have to stay in the ICU for a bit. And so they decide to cath me. They decide to put a urinary catheter up through the middle, and I have to do this with limited pain medicine. So, and plus, I mean, okay, this is a procedure that you don't have to do when a patient's sedated, but boy, is it preferred. Not me though, I'm awake. They're like, all right, 1, 2, 3, we're gonna feed this line up your pee hole. And so I'm taking this thing, screaming out in pain. This may have been the worst part of it, is just getting a catheter fed up. And for those of you who have had it, tell me I'm a baby. Tell me it's not that bad, please, because I'm being a baby. I'm complaining and it hurt. I think it hurt. Maybe it's not as painful as I think. So I'm in the ICU. At this point now, and I didn't probably preface the time period of what's happening or when this is happening. This was about 2 months ago, maybe a little less. So that puts us right about Christmas time. So I think I got admitted on December 15th, and then the admission pushed up through probably December 27th, I think was maybe my discharge date. Something like that. It was 14 days, I know. we're in the hospital for Christmas, so we don't get to do our plans. We don't get to visit family, and it kind of is what it is. As a CF patient, and you're watching this, if you have CF, you know this is not uncommon for us to miss holidays from being in the hospital. You all can probably relate to that, but that's just kind of like insult to injury. We've had so many things go wrong this admission. Missing Christmas is like kind of the least of our concerns. So we missed Christmas. This kind of takes me to the end of the ICU period. They transfer me back to the floor, and I'm stable, and I'm kind of recovering. I've lost a lot of blood. I have this enormous hematoma in my leg and groin, and it's really painful. But that kind of wraps up this admission. Now I want to go over what am I left with after this? What are the things that happened? Like, what did that cause me? Where did I end up health-wise? So this is what happened. I lost weight, and I lost a lot of weight. So during that ICU time, I wasn't eating at all. I didn't want to eat. I was sick. I was very sick. I lost 16 pounds in 14 days. That's over a pound a day. So if you have a diet that works better than the ICU diet, let me know. Tell me about it. So I'm down 16 pounds, and that's not fat, guys. That's some muscle that I put on over 6 years of weightlifting, and I have just atrophied like crazy. It's noticeable. It's visually noticeable. You all can probably see on me now that I don't look as big as I did, and it's tough mentally. It's tough mentally seeing yourself lose a lot of hard work in a really quick time frame. So next thing, kidney damage. You're like, well, how did I get kidney damage from this? During all the imaging and the procedure itself in interventional radiology, they have to give you contrast dye. Well, that's not a problem if you do that once every month. The problem is I had contrast 4 different times in 7 days. Now, the dye itself is actually kidney toxic. You get the dye, you have to have time for your body to flush that dye out. You basically pee it out, you break it down in the kidneys, and then it leaves your body. But this takes time. This takes, a week each time you get it, a week to flush out of your system. But I didn't get that opportunity. So every time I got dye and then additional dye, my kidneys weren't finished eliminating that waste out of my body. And so 4 times back to back just crippled my kidneys. To this day, 2 months later, we measured my kidney function yesterday, actually Friday, and it's still not good. My creatinine, for those of you watching that are my lab friends or healthcare workers in general, I left that hospital admission with a 1.9 creatinine level, and now yesterday we measured and my kidney function is 1.67. So that's still, normal range is like 0.8 to 1.3. So that's still far above normal. So this is kidney damage that it looks to be partially not reversible. So that's another thing. So I have the weight loss, the kidney damage, and then I have to deal with the blood loss. So I lost so much blood internally. That's not blood that gets to like circulate back into my system, even though it was inside of me. It's blood that has to be eliminated and bruising, and it has to be broken down and peed out, just like anything else that would be foreign to the body that's not in your bloodstream. And so I lost all this blood. My hemoglobin has dropped now to, 11 or 12. Normal range is 13 to 18. So I'm down at 11 or 12. This is not a normal range. Cystic fibrosis patients already have a lot of trouble making the appropriate amount of blood or maintaining the appropriate hemoglobin levels. So this is another thing that I'm still struggling with, and I can tell, like, with my weightlifting, with my energy level, it's not the way it was before, and I feel slower that way, and I'm less vascular. So we have the weight loss, we have the kidney damage, we have this blood loss, and then another thing is I have to deal with this enormous hematoma that I had, and it's almost all fixed now, it's almost all better, but I had this huge swelling and it was just like black. The whole area was just black because I had all this extra blood just sitting and just like getting old and like nasty, and it was painful, like a lot of pressure in your groin. Imagine like hooking up like an air pump there and just like, and it's like you have this huge swelling, very, very uncomfortable for the downstairs parts. So I'm left with all these things. I want to wrap the video up now. This is the main takeaway from all this stuff that happened. You need to be your own advocate. You need to understand that these people who are doing this procedure, they're just people. They don't always tell you, here's what might happen, here's what you should avoid when you're on the toilet. Don't push too hard. You got to understand that you need to be your own advocate. Ask questions. Buzz your nurse in. Ask to speak with the surgeon, the interventional radiologist who was in charge of your sedation, your procedure. Find out what you need to do, what you should avoid, and get some answers, because this kind of stuff, yeah, I signed the consent. Yeah, there's risks, but it's like you don't think this stuff could actually happen to you. What happened to me? And now I got to deal with 16 pounds of weight loss, tons of kidney damage, and just overall sluggish and low energy. So find out what you need to find out. Be your own advocate. Bring family around you. Have another set of ears listening to the things that the nurses and doctors are telling you. And then do research. Once you have information, they tell you the procedure that might take place, look it up. Find out all the risks that could happen to you, because it happened to me. So that's my takeaway. Advocate for yourself. Have a good partner, a good family around you to advocate for you. And just look out, because these are people, and you don't know if they've had a rough day. You don't know if they're going to make a mistake. You don't know if they're not going to give you all the information that you need. So look out for yourself. Keep following my journey. I got crazy good content coming. My next video is going to be about coughing up blood, just how it feels, what it's like, where I did it, and I can't wait to share that with you. I'm stoked. It's probably the video I'm looking forward to the most, actually, because I have a lot of information, a lot of experience coughing up blood, so watch out for that. Look out for that. And that's going to do it. So signing out. Temptation.